Vice President Kamala Harris has tested positive for COVID-19, and this comes as Congress debates another round of COVID relief and surprising new data from the CDC that found 60% of Americans have been infected with the virus at least once. So let's bring in Dr. Celine Gounder. She's a senior fellow and editor at large for public health at the Kaiser Family Foundation and Kaiser Health News. Thanks for joining us. All right, so sometimes I think, oh, we're kind of done talking about the coronavirus. I mean, there's stuff to talk about, but I feel like every few weeks or so we get some really interesting new information. But let us talk about the vice president. She's double vaxxed, she's boosted, she's, maintaining protocol, all that sort of stuff. She's still got this virus. What gives? How can you explain that?
Look, our vaccines are really good at keeping us out of the hospital, at preventing death. They're not so good at preventing infection. And so it's not surprising, especially with this super contagious Omicron variant, now that BA2 subvariant, that she might still have gotten infected.
But apparently she is taking all precautions, and she's taking that drug that we were talking about.
That's right, Paxlovid, which is an antiviral pill. It's a treatment for COVID. So if you do have an infection, it is highly effective also in treating you for COVID, keeping you from progressing to severe disease and ending up in the hospital. So get vaccinated, and then you got that safety net of the pill, Paxlovid.
Right. So let's talk about the CDC. So revelation. The CDC believes that data shows that more than 60% of Americans have been infected with COVID, but that number can actually be low. When I heard that, I thought, well, do we know how many people were infected before we even got the vaccine, before we even knew that COVID was a thing, and how many people have been infected since?
Well, we've certainly seen people infected with every wave of the virus, right? The original virus, the Alpha, the Delta, now the Omicron, and BA2. But we certainly saw a big jump in infections with Omicron because it is so infectious.
Does that number surprise you? Does it surprise you that some say, it's probably higher than 60%?
I would have guessed even higher, frankly. We saw so many infections over the winter holidays. I would have guessed higher.
Okay, so we talk about access to the vaccine. It's been almost a year now since most people got their first shot. People got seconds. Some people got boosted. If you're one of those people that got sort of the first two, you never got boosted, is your vaccine effective at this point?
It is still effective in preventing against hospitalization and death. Particularly if you're over age 50, though, I would get that third booster dose. It really does make a big difference.
So let me ask you about kids, because we're getting all this information about vaccines for kids. The CDC says 75% of American children have had COVID, right? Pfizer is asking the FDA to authorize a booster shot for kids ages 5 to 11. If kids have already been vaccinated, and chances are they may have already been exposed to the virus, do they need a booster shot, especially if they're not likely to get very ill?
Yeah, I think this is a bit more of a judgment call, just as the third dose may be more of a judgment call in a young, healthy person. But if you do have access to that third booster, there's really no downside to getting it.
I'm trying to just hit you with all the different questions that we have. Are we seeing long-term effects of COVID? When we talk about 60% of Americans have probably already been exposed, one of the first things I thought of was, well, how many people are dealing with long COVID without even knowing it? Are we seeing like an uptick in sort of long COVID type of, concerns, health concerns?
Yes, but it's a little early to say, right? Because we just had that Omicron wave over the winter holidays. We're just a couple months past that. Are the people who are experiencing some of the lingering effects of their COVID case, how long are those symptoms going to last? Is that really going to become long COVID? We're not completely sure yet.
And I guess we don't even really probably know exactly how to define long COVID at this point. Are there studies? I mean, is this an area where research there's a focus on research in this area? There
is, and the NIH, for example, has a very large study that they're trying to enroll people in, and oddly enough, they're having a very hard time enrolling people to study this very question of long COVID and how do you define it and how do you test for it. It's really been a challenge.
That is interesting that people are not participating, but I wonder, is it that they don't even realize that they may have long COVID? Do we know why they're having a hard time?
I think part of it is that the NIH study does not include treatment. It is simply following people, studying people to see what happens. And I think patients really are not interested unless you're offering them something.
Yeah, they're like, how are you going to make me healthy? Because it sounds terrible when you talk to people who are going through it. Dr. Celine Gounder, thank you so much.